And I'll start off by saying good morning to students, teachers, and presenters. Waitika, welcome to the second annual School District 83 CAMRT Career Exploration Series featuring the health services sector. Before I get into the introductions, I just wish to acknowledge this webinar panel discussion is hosted on the traditional unceded territory of the Secwepemc people, for which we call Salmon Arm. I know I feel very grateful being here on Secwepemc Hulu. We got a little bit of overcast sky today. It started off really sunny though, but we're going to have warm temperatures with a high of 11 degrees. Our snow is melting here. Probably has done a little bit of that as well through the interior of BC as well. I also wish to acknowledge literally the dozens of other Indigenous groups that exist all through our territory as we're covering this broadcast. We know at the very least there are a minimum of 8 school districts that are visiting us out of the 60 and are participating in this event. We have up to 60 registrants. So we don't necessarily have all of them live here, but I'm sure they're wanting to record and be able to watch this later on. I'm your host, George Richard. I'm School District 83's Career Education Coordinator. Good morning and welcome. Just some housekeeping administrative items to take care of for today's session. For teachers and students, please leave your screens and mics off. We do this to make sure that we don't have any background noise at all during the 75-minute session, and as well that privacy legislation is protected and that we're following that. If a student or teacher does have a question, we would ask that you write it down in the Q&A portion, okay, and not the chat. So if you're wondering where the Q&A section is, if you take your cursor and you just kind of move it around, you might see at the bottom where participants chat, react, share, and all those things are, you'll see something for Q&A. You'll be able to type in your question then. And we'd be encouraging teachers, especially with students, to be able to put in those questions there. You can write your questions at any time, but they may not necessarily be answered right away until we get to question portions of the meeting. We're hoping that's going to be taking place sometime in the middle and at the end of those presentations. So for now, I'd like to hand off this presentation to Sarah Eardley. She's the provincial manager for the Canadian Association of Medical Radiation Technologists. Thanks a lot for co-hosting the event with me today, Sarah.
Thank you so much, George. Really happy to be here, and thank you for that introduction. Hi, everybody out there. Thank you so much for joining us today. We're very excited to be here to share information about medical radiation technologist careers. As George mentioned, my name is Sarah Erdely, and I'm the provincial manager for BC at the Canadian Association of Medical Radiation Technologists. And I'm here today with several colleagues who are, throughout this presentation, going to talk about their career journeys and answer questions that you might have about our profession. But before we jump into their stories, I'm just going to provide you a brief introduction to our field and share some fun facts with you. And then after we hear from our career panelists, I'll then share some information about the MRT educational programs in BC and where you can go for more information on how to enter our profession. So like George said, please feel free to type questions throughout the presentation, and we will try to answer them during the breaks. And then I also want to let you know that we are recording this presentation. So if you'd like to revisit it, we'll have it posted on our YouTube channel shortly, and we'll promote it on our social media as well. So you might be wondering, what is medical imaging? Medical imaging is the use of different forms of energy that allows us to see inside the body, and it enables us to get more information about what's happening inside. This imaging helps the healthcare team figure out a diagnosis, so that means to identify the cause of a medical condition or determine the type of injury someone might be having after an accident, for example. And there's several different types of medical imaging available. X-ray, CT, MRI, these are just a few examples. Radiation therapy, which is also called radiotherapy, uses high radiation to kill or shrink tumor cells. And about half of patients with cancer get radiation therapy as part of their treatment. So medical radiation technology continues to evolve through technological advancements and new scientific discoveries. Just to give you a bit of an idea about this evolution in our field, I have a couple of fun facts related to the historical evolution of medical imaging and giving you a sense of where we started and where we are at today. X-rays were discovered in 1895, so that's more than 120 years ago. This discovery was made by a German scientist named Röntgen. The picture on the left here is a famous picture of the first X-ray, a picture of Röntgen's wife's hand. The picture in the middle, it gives you an idea of what X-rays look like today. Due to these technological advancements, we can visualize anatomy with much more clarity and detail, as you can see by looking at the difference between the first and the second picture of a hand. And the third image is showing a 3D look at the blood vessels in the neck and the head. So these types of images are obtained by injecting a contrast dye and then taking a scan that's timed with the injection. The next fact that I have for you is BC's first cancer treatment center opened in 1938. There's now 6 cancer centers in BC, with more planned in the near future. MRTs play a critical role in cancer care. BC has several cancer screening programs, including breast screening, where MRTs are the ones performing the mammogram, so that's images of the breast. Also lung screening, where MRTs perform CT scans of the lungs. MRTs who work in medical imaging departments and hospitals and clinics also play a role in diagnosing and monitoring cancer by taking images that show us what's happening inside the body. And radiation therapists play an important role in cancer treatment. So our speakers are going to provide you with more information and examples later in the presentation. And the last fact that I'd like to share with you is that we are now performing more than 6 million medical imaging exams annually in BC. So our field is in very high demand, and we expect this number to continue to grow as the population grows and the healthcare system continues to evolve and expand. MRTs are very important and make a significant impact on the healthcare system. About 3 in 5 Canadians will receive care from an MRT or a sonographer each year. And I already mentioned about 50% of cancer patients will undergo radiation therapy as part of their treatment. So we have the very important role of providing care and comfort while ensuring high quality and safe imaging and radiation therapy. So to summarize, MRTs are highly educated and caring professionals who perform medical imaging and radiation therapy procedures in a variety of clinical settings. There are 4 different subspecialties or disciplines that you can choose from to enter the profession. And some MRTs are also trained in more than one specialty. So these are shown on the slide here. They're radiation therapy, nuclear medicine, radiological or X-ray technology, and magnetic resonance imaging. To help you gain a better understanding about each of these specialty areas, we have a group of professionals here today to share personal stories about their career journeys and other insights about their job. First, you're going to hear from Jasmine and Jessica about radiation therapy, followed by Joanne about nuclear medicine. After that, we'll take a quick pause for a couple of questions, and then we'll hear from Hong and Paria, and we'll have a second round of questions at the end. And I'll also go over some information about where you can study and train in BC to become an MRT. So I'm now going to hand it over to Jasmine and Jessica.
Hi, my name's Jessica.
I'm Jasmine.
And we're both radiation therapists here. We both went to BCIT together, and we just graduated this last May 2024. And we've been working for about 8 months now at the Surrey BC Cancer Centre. What led us into the MRT career? For me, I was actually doing an undergrad degree in biology before I even discovered radiation therapy. And after that degree, I was volunteering at BC Cancer, still trying to figure out what route to go. While I was volunteering here, I actually met a radiation therapist herself who came up to me and was just asking what were some of the options I was thinking of. And I said, honestly, I'm not sure. And she recommended this career for me, which I thought was surprising because a lot of people usually don't recommend their careers kind of later on in their 10, 15 years of working. But she was saying it was an amazing career. It was a really benefiting, like to take a look at it. And I was like, you know what, maybe I should go home and kind of do my own research and see, because no one would come up and be like, hey, you should do this job that I've been doing for 30 years now with that much passion. So from there on, I went home and I looked at it and I was like, oh, this is really interesting. Radiation is definitely a field that's very niche to itself, so it's not something you see everywhere. So it's kind of hard to understand back then because there wasn't much information. But once I did some research, I'm like, oh, this is interesting in the way where we're working with modern technology, as well as there's patient care interaction as well. So it's interesting to combine both of them together. And then from there, when I looked forward and I decided to apply, since then, honestly, it's been really great for me. The program itself is a 3-year program. So I had already finished a 4-year biology degree, so I had already had a year of prerequisites, which I feel like for most of us as well. Jasmine also did a undergrad in
biomedical physiology.
Yeah, so both of us were kind of looking for something to do after that, and radiation was probably the best fit for us then. So using our undergrad credits from there, we were able to get into BCIT. We did our 3-year program, and from there, there's also didactic and clinical portions of that as well. So for the first year, you're just in school learning, and then in the next semester, you go to clinical for 4 months where you get hands-on experience as a student, where you get to work with RTs like ourselves. And from there, you learn every single day, slowly building up your skills. And then you go back into school, learn some more information. You have another 4 months in clinical. And this is a really helpful way for you to build your experience instead of just kind of being thrown all at once. You kind of get the help of also learning and then going back into actually being in the radiation career and learning from therapists and working with your colleagues and potential future, employers that you'll be with. And it's a great way to kind of immerse yourself into this career early on while just being a student as well, because a lot of people remember all the students from first year, second year, and third year because it's such a niche career, and there's only a few centers here as well. But that was a good experience for both of us, I could say.
Yeah, I'll just walk through a day in our life, I suppose. It's kind of different depending on the position that you're in. Us just working on the floor, there's different shifts you'll take. So for most of the day, you're treating patients. There's 2 different sides. You're either treating while you're image matching. I don't know if I should get into too much detail just because there's a lot of information you probably won't know, but you're always working with a partner. It's a big safety issue. So you always have 2 opinions before you continue with the treatment. So someone is taking the images, you're matching, you're performing the actual radiation treatment, while the other partner is documenting all of the information, telling you anything that's important. And then in that situation, you also might have a student at there as well. So that's something I'll also mention that I feel like we probably didn't know as well, that once you actually are employed, you are usually always a teacher as well. So there's always a student. So for most of the day you are treating, and then you also do have out time or you're performing any documentation, any paperwork. Every week we're doing QA daily checks just to make sure that the radiation treatments that are being performed are performed correctly. If anything's missed, it's going to be seen there. Yeah. And then there's also different positions. So you can either go into DOSIM or CT planning. Usually radiation therapists that go into those sections have been working for a while. So DOSIM are the radiation therapists that are actually planning the treatment. And then whereas the CT SIM radiation therapists are performing the CT scans. So the normal routine for a patient is when they are ready for radiation treatment, they will come and have a CT scan. And then that CT scan is sent to DOSIM where they'll plan the treatment. And then that patient will come to us.
Yeah. And like Jasmine said, I feel like for both of us, something that's really rewarding about this career is being on the treatment floor ourselves. We get to not only treat the patient, but we're having that patient interaction. Every day you do see these patients sometimes for a week, or at least for up to a month and a half, where you see them every day from Monday to Friday, since the cancer center is closed on the weekends. And you do develop this relationship with majority of your patients where you're not only just helping them get through their treatment, but you're also kind of acting as their support system in a way as well, and kind of recommending them suggestions, as well as if they need any extra support, we're also here to give referrals as well to them. But I feel like that part of their career is definitely fulfilling and rewarding. As well as Jasmine had mentioned, the different positions that you can go into as a radiation therapist, I believe is great for your career, especially starting off on the treatment floor is great. And then if you feel like you wanted to move into CT, you can also do that in the future, or if you want to go into DOSIM. With this job, honestly, the education is plenty. You can continue your education even though you do have your bachelor's degree. If you wanted to continue on to do extra courses, that's also available here as well. And doing your master's as well is something that a lot of people do, and go into resource positions, into those types of different higher up positions. So it's a great way to work yourself up there if you wanted to do something more and not just be on the treatment floor as well.
Yeah, and I'm also aware that if you do decide to do further schooling, there are grants that you can do that BC Cancer will pay for.
Yeah, so it's definitely very supportive as well here. Everyone is always recommending us to take courses. Everyone is very close here as well. A lot of our colleagues now, 7 of us graduated together from BCIT, and we all are actually working at the same center. So it's really nice to be with the people that you went to school with are now also your colleagues, and we create this friendship, and it's just really amazing to also be working with, your friends. And it's something that you don't see in other careers, especially as well.
Yeah.
Excellent. Thank you so much for sharing your story with us. Before we move on to Joanne, I'm just wondering if you can tell us just really quickly what we're seeing on the slide here.
Yeah.
Yeah, so on the left is an example of like image matching. So at the top, you have the computer console with images. It looks like we're treating a portion of the spine. So those are the images that are taken during the CT scan. They're reconstructed to be called something called a DRR. And then every single day before we begin treatment, we get the patient on the bed. They're given tattoos during the CT scan. And then in our actual treatment room, we have lasers, and we use those lasers to position the patient exactly how they should be every day. But we will leave the room, we'll take images. It's either a X-ray or a CT scan. They're usually low dose CT scans. And then from there, the image that we take that day, we will image match that to the DRR, because the DRR is what we use to plan the treatment. So usually they're very minimal moves, and then we'll move the bed to get the patient in the exact same position that they should be during treatment. And then just below that console, or the computer monitor, is our console. So that's the little buttons we press to actually perform the treatment.
Thank you so much. Really appreciate it. We'll see you guys in a few minutes after we hear from Joanne. We're going to open it up to questions to the audience, but now we're going to move on to the world of nuclear medicine for a few minutes. So thanks so much, Joanne, for joining us.
Hi, Sarah. I'm happy to be here. My name is Joanne, and I'm currently the site coordinator, which is like the manager for the medical imaging department at Royal Columbian Hospital. I've been in this role for about a year and a half, and prior to that, I worked down the hall in nuclear medicine for about 25 years. So I'm very passionate about nuclear medicine as a modality, and I'm going to have a hard time telling you everything I want to tell you in 7 minutes. So I'll try my best. So, like many of you today, I had never heard of medical imaging, or sorry, nuclear medicine as a modality within medical imaging. Most people know what an X-ray is or CT scan, even an MRI, but not nuclear medicine. And I was at college working on my chemistry degree and really needing a job. And I started looking into what options were out there. And I found the health sciences. I looked at pharmacy and lab and X-ray and stumbled across nuclear medicine. And to be honest, I thought it sounded pretty cool. And being able to do school in 2 years and then come out and get a job sounded really enticing. So obviously that's what I did, and I have no regrets. So let me tell you a little bit about what nuclear medicine is, because it's a little bit different than some of the other modalities. So we use radioactive isotopes that are administered to the patient, either by an injection In this slide or this picture, we've got one of our nuclear medicine technologists that I used to work with, Haley, who is preparing to give a patient an injection of a radioactive isotope. So it either goes into the bloodstream, kind of like a blood test, straight little needle poke into the arm. We use a smaller needle than blood tests, or we can set up an IV and inject through the IV. We can also do intradermal injections, which is just under the skin. We can also administer our isotopes to patients by having them drink in some water or swallow a capsule, or even feeding them radioactive scrambled eggs. We can also have them inhale the tracer and do pictures of their lungs. After we've administered the tracer, we either take images right away, and that would be looking at the flow of the tracer through the body system. So because we're giving it to the patient, we're looking at how the body's functioning and how the body's processing and metabolizing the tracer. And in some areas, nuclear medicine is actually called functional imaging or molecular imaging. So if we're imaging right away, an example would be like a kidney scan where we inject and we watch the kidneys absorb the tracer and then excrete it through the urinary system, or a gastric empty. For example, those scrambled eggs that we make radioactive and feed our patients, we watch it as it fills the stomach and then how long it takes for the stomach to empty the tracer. But many of our exams, we need to wait. So we would administer the tracer and then wait between a few minutes to several hours before we can take pictures. And an example of that would be a bone scan where we administer a radioactive phosphate, and it can take between 2 and 6 hours for the bones to actually absorb the tracer before we can see it. Thanks, Sarah. Great timing. Our day begins bright and early, 5:30 in the morning. Our hot lab technologist comes in and we milk the generator. So that canister on the left that you see is a generator. It's not an electrical piece of equipment. It generates the technetium 99M that we use for the majority of our exams. So inside that canister is some molybdenum 99 that decays into technetium 99M. We pop a vial of saline on one side of the generator and an evacuated vial on the other side, which draws the saline through. It picks up the technetium, and we're left with a vial of technetium that we use for the rest of the day. From that vial of technetium 99M, we make other radiopharmaceuticals that we'll use depending on what patients are scheduled for the day. So, for example, that bone scan that I mentioned, we are administering a radioactive phosphate. It's called MDP. The P stands for phosphate. Phosphate is something that your bones are made of. It's treated very similar to calcium and other minerals in your body. So your bones will just naturally absorb that phosphate that we've made radioactive. We use other isotopes as well. So we use radioactive iodine 123. We use that for thyroid exams. Your thyroid uses iodine. It's an essential element and incorporates it into thyroid hormones. So we use iodine 123 to image thyroids. We can use iodine 131, which emits a beta particle, which can treat thyroid conditions like hyperthyroidism or even thyroid cancer. We can use gallium-67 for some inflammatory diseases, and indium-111, which is another isotope that we can do a pretty cool scan with. We do white blood cell imaging using indium-111 or technetium-99M. We draw a blood sample from the patient, and white blood cells are one of the larger cells found in the bloodstream. And so we can use a centrifuge to separate out the white blood cells. And then we attach the radioactive tracer, either indium-111 or technetium-99M, to those cells. And once that tag is complete, we can re-inject the patient with their own white blood cells. Normally, white blood cells are found in the bone marrow, the liver, and the spleen. And of course, there's some in the bloodstream at all times. But any accumulations of those white cells outside of those areas are an indication that there's an infectious process going on. So we can take images, and if there's an accumulation in the patient's foot, for example, maybe they have osteomyelitis in those bones. So it's a really important exam that we do. Our exams are a little bit different than like a CT or an X-ray where the radiation comes from the piece of equipment. For us, the radiation comes from the patient. We've injected them with those isotopes, and the isotope emits a gamma ray in most cases that is detected by the gamma camera and produces the image. Our newer gamma cameras do have a CT scanner that is incorporated into it. So after we've acquired the nuclear medicine images, then we can perform a CT scan. And what we can do is overlay the nuclear medicine images on top of the CT scan. And now we've got function with anatomy. And so we can really localize what is happening and where in the body. So some of the types of scans that we do were bone scans, like I mentioned. And in this particular image, oh, you might not be able to see it really well. Sometimes we have incidental findings where the tracer happens to flow through other areas, for example, the kidneys. So our kidneys are constantly filtering our bloodstream. So when we inject the phosphate into the bloodstream, it will get absorbed by bones, but what your body doesn't want gets excreted in your urine. And you can maybe see the bladder in this image is a dark ball in the bottom of the pelvis, but there's also a kidney that is showing up in this image, which is kind of a interesting we usually see kidneys, but not in this presentation. We can also do cardiac scans where we have a patient on the treadmill, and while they're exercising on the treadmill, we inject them with a radioactive tracer that goes to muscle. And your heart's a big muscle, so it will absorb the tracer. And what we're actually looking at is if the patient has any blockages in their arteries in their heart, then our tracer can't get past it. And so we should see an even distribution of the tracer within the myocardium. And if there isn't, then it could mean that the patient has some blockages. I find nuclear medicine is a very interesting modality. It's very unique. It's very diverse. Our scans are not quick, so we get to spend time with our patients and get to know them over the course of the time that we're with them. Oh, thank you, Sarah. I forgot I submitted this one. This is a gastric emptying. So these are those radioactive scrambled eggs that we've administered a patient. And you can see that big ball is their stomach. And then as the digested and excreted throughout the rest of the intestines, we can see it flow through the intestines. And essentially, what we're looking for is how quickly or maybe not quickly the stomach's able to empty. So some patients have troubles with that. I'm not sure how I'm doing for time, so.
A few more seconds and we'll move into questions.
Awesome.
Yeah.
Okay. So yeah, I was just mentioning before this slide that nuclear medicine I find is very, very diverse. It's very interesting. We are starting to collaborate more with other modalities as well, such as breast imaging. We do an exam where we help localize lymph nodes for patients going for surgery. So we're, working with surgeons as well, and also with other modalities like interventional radiology, where we can bring isotopes over to their department, which are used to treat some liver cancers. So it's a very underrepresented sometimes, I feel like, but very important imaging modality within medical imaging.
Thank you so
Right.
much, Joanne.
Yep, no worries. And we're going to be getting to some of your questions. So I thank Triple J at this point. That'd be Jasmine, Jessica, and Joanne. And if Jasmine and Jessica can get on their cameras, that would be good at this point. We thank the questions that have come in already in the Q&A, which has been great. And we would be encouraging those teachers who are with students, if any of those students have any questions, to please put them in the Q&A, and we'll see if we can get them out at this point. First question comes from my hometown of Nanaimo. Good to see Candace, or how she refers to herself as Candy. What is the school course load like for the programs in the different modalities? So I think that's been kind of addressed in respect to a 3 and a 2 year, if I remember correctly.
Yeah, 3 years for radiation therapy.
And you're
And yet,
full time.
and 2 years is nuclear medicine.
Yeah, and then I guess what they're meaning is for course load. I mean, is it considered heavy? Like compared, let's say, compare that, let's say for Jasmine and Jessica, to your university experience now doing that.
I think personally doing an undergrad, it wasn't that difficult for me. because when I was in school, I was still working. Even when I was in clinical, I did do some part-time work on the weekends. So I was able to do all of that. At points when you are in your second to third year, you're learning a lot of oncology. It is a lot of information to know. So I think it's just really on you to be able to create good study methods for yourself to be able to handle it all. But personally, I was okay with it.
Yeah, I would say the same, especially with the information that you're learning, you're using this for the rest of your career. So you're actually really interested in knowing everything, which I think makes it easier as well.
Okay, and for our next question, it's tied to the radiation therapist, but we'll throw this to Joanne as well. And that is, how is the work-life balance? Do you feel stress at all during your working hours, and then stress about work often during your days off? How does that work? And we thank Charlene for that question.
Um, I think one of the biggest challenges in this job can be burnout. It's really important for you to be able to figure out different methods to deal with your mental health. Like, you are working with patients that have a lot going on. Empathy is going to be your strongest suit in this type of career. So being able to be good at your job, but also take care of yourself is really important. Create those methods, talk to your coworkers, talk to your friends, talk to your family, get a counselor. We have benefits for that. So be able to create those strategies for yourself. But personally, I don't think I take my job home. I don't personally come to work and feel stressed. But the thing is, if you do have challenging patients, you have resources, you have your colleagues, you have people that have more experience than you. So if you ever are in a situation where you're not sure what to do, there's always other people there to help you.
Go ahead,
I
Joanne.
would I would agree with Jessica and Jasmine. It's really important to just take care of yourself, and take advantage of the resources available to you if you are finding that. I do find though that at work, I mean, we don't, taking some of the challenges home with regards to the emotional aspect of always caring for patients who, need care, um, can be a challenge, but at the end of the day, your shift is over, and if you find those ways of dealing with that, we don't then it's not overwhelming. In nuclear medicine, in particular, we don't tend to work weekends and we don't tend to do calls, so the work-life balance in that respect is quite nice. It's kind of a Monday to Friday kind of job, whereas other modalities are open 24/7. So that's one of the nice things about nuclear medicine.
Yeah,
Excellent.
I'll piggyback off of that too. We only work Monday to Friday.
Yeah.
You work,
Weekends and stats are off, and if you choose to, you can do on call. That's up to you, but yeah.
Okay, that's good to know. This next question, we have about a couple of minutes before we get on to the next presenters, but I'm going to kind of combine them. Thank both Salmon Arm Secondary and JL Jackson Secondary for these questions in particular. And I'm going to break it into sort of two groups. They talk about the side effects or long-term effects on the body of people receiving radiation therapy, right? Whether it's from the external that the radiation therapists do, or the internal through nuclear medicine and radiation scrambled eggs. Here, I thought I was the only one making them when I was doing stuff on the weekend. But regardless, I'm just curious, not just for the patients, what are the side effects that they face when it comes to radiation, but also the long-term effects for the workers, for yourselves? What sort of safeguards are in place when you're dealing with potentially toxic sort of substances that way?
I'll, I'll go first from the nuclear medicine perspective. So the nice thing about nuclear medicine is that because want the patient we want that tracer to actually be absorbed and follow a natural process in the patient's body. There's very little chance of side effects. Our tracers are so close to what is naturally occurring within the body that from that perspective, there's no side effects. From the radiation perspective, we can't ever say that there's no risk because that's not true with radiation, but the amounts of radiation that we're administering our patients are very, very low. And there's always that benefit to risk ratio. So patients aren't being injected with radiation because they're healthy. They're being injected with radiation because we're trying to diagnose or treat something. So that risk benefit comes into play. But from the radiation, like we get questions all the time. Will I get super powers? Or will I glow in the dark? And none of that happens just in the movies. But seriously, a lot of our tests are even less radiation than a CT scan, or we compare things to natural radiation that we get depending on where you live in the world, or airline, flight to New York, you're exposed to radiation in our daily lives anyways. So I put those questions, when I get those questions, I put them into context for patients so that they can kind of understand that. And then from the worker standpoint, it's highly regulated. So we wear dosimeters that monitor the radiation exposure that we receive as workers, and we need to keep that under a threshold. And we are well under the threshold. I've never seen a worker exceed any workplace health limits.
So
Yeah, go ahead,
for
Jasmine. Just
radiation,
anything to add?
yeah, for patient-related side effects, usually where we do radiation, it's very localized to the area of treatment. And that is something that we also do go over with them before we take them in for radiation treatment, is go over all the side effects that can happen. There are short-term side effects that they experience and then that go away after they're done treatment. But there also are just long-term side effects of just depending on where we're treating on that site. And that's what we educate the patient. Not each patient is going to have every single long-term side effect, but it's something to just be aware of since, again, as Joanne mentioned, the risk to benefit ratio, we are treating their cancer with radiation, but however, in the long-term run, radiation itself also can sometimes damage the surrounding organs that are there. But for the most part, the doses that we give, usually we try to minimize this and only focus on the area that we're treating. And then for radiation for us ourselves, we do get monitored by wearing these TLD badges every day. Each one of us is required to wear this, and this is replaced every 3 months and sent back where they check to make sure that we're not receiving any extra dosage. For radiation therapists, we are considered as the regular public, so the amount of radiation we receive should be the same amount that someone else on the side of the street should be receiving. So it shouldn't be any more than that. So that's also, I know, a question a lot of people have, especially my parents when I first went into this thinking, oh, radiation, but there's a lot of safeguards put into place, a lot of QA checks, a lot of monitoring that goes on with this. So it's very, very safe in that term.
Okay, that's great to know. And for the folks out there, please have your questions coming. JL Jackson, I know you have a really good question, and we're going to be definitely getting to that near the end. We should be going on, though, and we're going to be turning to radiological technology, or as we refer to it in sort of layman's terms, X-ray technologists. For that, we turn to Hong Jiro, and I'm just wondering, Hong, if you're there, if you can speak on up and carry on, that'd be great.
Thanks, George, for the introductions. Hi, everyone. I'm Hong Jiro, and I'm actually here in beautiful Victoria. The weather is amazing here today. And I'm on the unceded territories of the Lekwungen and Songhees peoples, and I'm just grateful for this opportunity to be here with everyone, sharing stories and just learning from each other. So like George said, the Triple J team, Jasmine, Jessica, and Joanne, they're MRTs, and I'm an MRT as well. But I work in a different area as an MRT. I work in radiography, or as George also said, I'm an X-ray technologist, is another way that we're called. So if you've ever broken a bone or thought you broke a bone or had to have it X-rayed, it likely was an X-ray tech or radiological technologist who was taking your X-ray. But there's lots of other things that X-ray techs do, and I'm here to tell you a little bit more about that. But first, I just wanted to tell you a little bit about my journey into the MRT world to give you an idea of how my education and career started. So it actually began around the turn of the millennium, I guess you could say, around the year 2000, when I was in the same place as many of you on the call are. I was in high school and just trying to figure out what I wanted to be when I grew up. And though I didn't quite know what that was yet, I did know a few core things about myself. And some things were that I knew I liked teaching, and I knew I liked healthcare and helping people, and just feeling like I could, if I could make a difference, even if it was in a small way. And so in grade 12, and if you're in grade 12, maybe you're in this position as well, or in high school anyway. I took a lot of sciences. I took calculus and chemistry, biology. I took a health sciences 12 course that gave me some college credit as well. So then after I graduated high school, I went to the University of Victoria. And while I was there, one thing that kind of worried me was that, after my time at UVic, I still wasn't sure where that was going to land me at the end of this, probably 4 years of school. And I was really worried about what I was going to do with my life after my education. So I thought I better get serious and look on the internet and see what else was out there. And at that time, and this is kind of why I'm so grateful for this opportunity, because there wasn't opportunities like this for me when back then to learn about healthcare fields. The only thing I knew was that there was doctors and nurses that worked in hospitals. And I didn't know anything about MRTs or really any of what we call allied health professionals that worked in the hospital. So I stumbled upon the medical radiography program at BCIT, and that program is in BCIT is in Burnaby. And at the time, that was the only school in BC that offered that program. And when I was reading about it, what really interested me about the program was that it was a healthcare field that dealt with a lot of technology, that involved problem solving in a very real world sense. And that was all done while delivering patient care. So, for a science minded person like me at the time, it seemed like a really good fit. So I entered the program at BCIT in 2003, and I graduated in 2006. And I was lucky enough to be able to come back to the island in Victoria and work at Victoria General Hospital in 2006 when I graduated. And I got a job right away at VGH, and working in X-ray was sort of the career that I had hoped it would be when I was searching for that, several years prior. And working as an X-ray tech, I saw patients from all over the hospital, and they were all at various stages in their diagnosis and care. I might be seeing a patient who was sent there by their family doctor who had arthritis in their knee, or a patient coming from emergency who needed a chest scan right away because they hit a tree while skiing, or it might have been a patient that needed a brain scan because they had just had a stroke in their home. And on other days, I might be in the operating room because it was a patient that needed shoulder surgery from a mountain biking accident. And some days I'd see all of those patients all in the same day. So in each of those scenarios, it meant that I had to use my theoretical knowledge of the human body and the technology that I had in creative ways to figure out how I was going to take my x-rays to be able to care for this patient and help in their diagnosis. So I worked in X-ray. So like I said, starting in 2006, and I eventually moved into a relief supervisor position. And then I started working in CT as well and got my CT certification in 2014. And then in 2015, an opportunity opened up at Camosun College here in Victoria for an instructor role in their medical radiography program. And at that point in my career, I felt like I was ready for a new challenge. And this had opened a door for me that I thought had disappeared actually, because I could now teach. And that was something I always had wanted to do. And being a teacher has been really rewarding and definitely challenging at times, but it's been a role that I've really embraced, because it's really actually helped me to bring the two worlds together. But my real world MRT experience from the hospital, I can now bring it to the classroom, and that really helps in my teaching with the students who will eventually also head out there. And I spend most of my time teaching now, but I occasionally work in the hospital, and that helps me stay current in my practice and in the technology because MRT technology is constantly changing, and that helps me bring that back to the classroom and help in my teaching there. So I've been teaching at Camosun College for about 10 years now, about the same length of time that I was a technologist. And I wanted to share this with you and hope maybe what you take from this is that a career in the MRT world might be right for you if you like science, technology, problem solving in creative ways, and helping people and making an impact in their care and diagnosis. Sarah's just showing some pictures of some of the labs that we do in the program at Camosun College where students take x-rays on mannequins, and then we don't x-ray each other, but we do these positioning labs where we position each other and practice that in labs before heading out into clinical practicums. And maybe if you decide to go into the MRT career, and just knowing that there's many paths for you that you can take. You can go into supervisory roles, you can work in other imaging modalities like CT, or you can go into teaching. Or research is also another one that I think our students are exploring more and more as well. So yeah, I just wish you well wherever you are in your journey and wherever your journey ends up taking you.
Thank you, Hong. Thanks so much
Thanks,
for
Sarah.
sharing your story and kind of telling us where you were at and what you were thinking and making it relatable as well for the students in the audience today. We're going to hear from Priya about MRI, another imaging modality, and then we'll invite everybody back for some more questions at the end as well. And like I said, I'll also provide a couple of slides around where you can go to school in BC. So I'd like to welcome Priya now.
Hi, everyone. I'm Priya Maletta. I'm an X-ray, CT, and MRI technologist, and I've actually been working as a technologist for 6 years now, and I'm just going to first speak to the path I took to get to where I am now. So I started with a Bachelor's of Science at UBC, and once I finished, I really just wasn't sure what I wanted to do as a career. I just knew that I wanted to work in the hospital and combine my interest in the sciences with my passion for patient care. Well, life took me to Prince George pretty soon after, and I found the medical radiography program at CMC, the College of New Caledonia. And I was able to actually get a job right out of school at UHNBC, the hospital in Prince George, which actually is a theme amongst us MRTs getting a job right away. So that was very nice. And I won't repeat what Hong has so eloquently already spoken about with X-ray, but I had an amazing time beginning my career as an X-ray tech. It helped me strengthen my anatomy skills and really better understand the flow of the hospital, not to mention how to actually operate the technology efficiently. While I was working in X-ray, I was exposed to the fast-paced and exciting environment of CT. I decided to complete the 3 courses required, and then I had the opportunity to get my training done. From there, I began working as a CT and X-ray hybrid technologist, often dealing with emergency cases, trauma patients, stroke patients. And of course, it can be quite intense, but overall very rewarding. Just to touch on CT, it's essentially X-rays that create a detailed cross-section of the body. We sometimes like to say it's like taking a loaf of bread and slicing it, and each slice is the image. Now, I absolutely loved my time in CT, but as my confidence in anatomy grew even more, and Hong, you mentioned research is really exciting to us MRTs. So I then started looking at the MR images and wanting to create those. So I guess on the slide, you can see, yeah, there we go. You can see the difference in imaging between CT and MR. And this is not to devalue the importance of CT. It just shows how the different modalities are all valued for different pathologies and for different patient conditions. For instance, a CT can take a couple minutes, whereas an MRI can take half an hour for the same body part. So what is MRI? Basically, MRI uses powerful magnets and radio waves instead of radiation. There's a lot of physics working behind the scenes, but I won't excite you with all of that today. Instead, I'll start with going through some fun facts about the magnet. So as a technologist, we go through an extensive screening process with the patients to make sure that they're able to actually enter the scanning room. This is to make sure that there's no ferromagnetic materials, no medical implants that can interact with the magnet. To kind of put into perspective how strong a 1.5 Tesla magnet is, which is the magnet that I currently work with, it's about 30,000 times stronger than the Earth's magnetic field. So to kind of get a sense of what this would feel like, it's, let's say you walk in with one of these hair clips in your hair, which should actually never happen for a patient, but if you end up getting close enough to the scanner, you will definitely feel it tugging on your hair. Another interesting fact is that the MR machine can essentially watch your brain light up in real time when you're experiencing a memory, an emotion, or moving a certain part of your body. Now, I'm personally not too familiar with this, it's called functional MRI or fMRI, but it's definitely an interesting use of this modality. Another thing you'll notice on the next screen, that there is a screenshot of what our scanner page can look like. These numbers and parameters are all factors that as the technologist we can change to create better pictures for each patient. I'm personally, I guess, newer to MRI, so I'm still really trying to learn how to adjust each one. But it is super fun knowing that you have the ability to create a beautiful image on the fly. And this is definitely an area where you have to constantly be thinking. I also find that MR is kind of like a race against the clock because you're trying to get the best image possible for the patient in the least amount of time. But I guess that's what makes it fun. I do want to mention that there are two different streams of getting into MRI currently in BC. So I had personally gone down the X-ray to MR route by completing the 2-year online advanced certificate through BCIT. But now we have a first discipline full-time diploma through BCIT, which you can enter out of high school or if you've had some post-secondary as well. Anyways, overall, I just wanted to end off saying that I really do love my career and how I am able to help in a patient's diagnosis and essentially act as the eyes of healthcare. I also love that with this career, there's always so much to learn. I can't say that a day or honestly even an hour goes by that I'm not learning something new, whether it's from my colleagues, from the imaging, or even from the patients that we see. I realize that there's essentially no chance of being bored as an MRT. So if you love problem solving, working with cutting edge equipment, and making a difference in healthcare, this may definitely be the career for you. Thank you.
Thanks for sharing your story. I mentioned at the very beginning that we have different specialty areas for how you can enter into the profession. You're a great example of someone who's gone through a couple of different imaging modalities and has dual certifications. Thanks for sharing that. I'm going to provide a little bit of information about the steps to become an MRT before we move on to the Q&A. Again, we should have quite a bit of time for questions here, so keep them coming in the chat in the Q&A feature. So there's ways to become an MRT through international education, but for the purpose of this presentation, I'm only speaking about completing a Canadian program. So the first two steps to becoming an MRT are complete the education and complete the certification requirements. So after completing a Canadian accredited MRT educational program, graduates write a national entry-level certification exam. This exam is administered by our organization, the Canadian Association of Medical Radiation Technologists. Upon successfully passing the exam and earning entry to practice certification, the last step, depending on the province where you live or work, is to register with the provincial regulatory body to maintain a license to practice. And like I said, this step does depend on the province that you're working in. So if you want to explore this more, if you're thinking of moving outside of BC, for example, then you can find a list of the MRT regulators in Canada at this link on the screen here. There's several fully accredited MRT educational programs right here in BC. Currently, you could study at any of the MRT disciplines at the British Columbia Institute of Technology, BCIT, Their campus is located in Burnaby. I think that's been mentioned a couple of times already. And you can study to become a radiological or X-ray technologist on Vancouver Island as well, or in northern BC, like Priya mentioned, she went to the College of New Caledonia in CNC at CNC in Prince George. So here's just a list. You can screenshot this, or you can come back to our recording on YouTube later to find it, or you can visit our Accreditation Canada's website to find the full list of accredited programs in Canada. But this gives you the current list of Canadian accredited educational programs in our province. Most are 2-year diploma programs, and radiation therapy is about 3 years. I'll just end off by saying that the MRT profession is full of opportunity. And if this is something that interests you in the future, if you complete one of the diploma programs, it would be good to know that there's post-secondary institutions that offer degree completion programs for MRTs as well. So you can apply for transfer credit, or some programs have articulation or agreements already in place. So if that's something that you're wondering about. There's also many opportunities that have been highlighted by our speakers today, through some of their examples that they've shared, for us to expand our clinical skills beyond entry to practice. This includes specialty certificates, micro-credentials, webinars that you can attend, conferences, and so many other activities to help you advance your knowledge and skills in our field. And some MRTs even go into leadership roles or teaching or pursue research projects and much more. So just to find out more about each educational program, I encourage you to visit the institution websites and search the programs. This is where you'll find information about the specific entrance requirements, application deadlines, and also to find out when they're having their own info sessions. And you can also find most of the programs on Instagram. So feel free to follow these programs. They do some awesome posts. And you can find our association there too. This is where we'll promote when our recording of this video is live and ready to be viewed on our YouTube channel. And now we'll just finish off the session today by taking more questions that you have for us.
And oh, the questions are just rolling in like Oklahoma Thunder, I can tell you. So we have, for all intent and purpose, a little around 15-ish minutes or so for the questions. Just because of the benefit of Hong and Pura to be able to possibly answer some of these questions first, that would be appreciated. But we could also have Triple J, of course, being able to plug in as well on certain things. One of the ones that came from JL Jackson before, and I want to revisit it again, is for a high school student that may be watching right now, anywhere from grade 10, possibly to grade 12. What are some of the courses that ideally they should have in their kit that would assist in going forward?
I guess I could field this one for the X-ray program. And I think it's pretty similar across all 3 schools that offer the X-ray program, but the 4 grade 12 courses are math, biology, physics, and English with a B grade minimum for all those are the standard prerequisites.
Okay. And when you try, oh, here's something else too. How competitive is it to get into these programs? Whether it's at Camosun in particular, or BCIT, or up north in Prince George. How competitive is it to get into these programs?
I'll answer for the Camosun program in particular, but I would say that it sort of fluctuates from year to year. Some years it's very competitive where we have a lot of applicants, and some years we have less applicants. So I would say there's no trend currently for the last, like, I guess 5 years, I would say. So if it's just something you're interested in, look into what the prereqs are and just get yourself prepped and ready to apply when the application cycle opens, before when you want to join the program. Yeah, just go for it.
Yeah, and I can't help but to notice the vast majority of you came into these fields after completing a Bachelor of Science degree. Now, is that a recommended way to go about this, or can you go right from high school into programs, 2 or 3 year programs like this? You probably could say, yes, you could, I would imagine. But what I am wondering is there a strategic advantage in having your Bachelor of Science degree before coming into a program like this? I'd be interested in both responses.
I think for our program, you do need at least a year of undergrad to have those classes. Same thing with high school. I think we just need math 12, physics,
English,
I believe.
yeah.
Yeah. Personally, I think having a full undergrad degree versus just 1 year really depends on your personality and your work experience. One of the biggest components of this job is being able to speak with patients, having that empathy. So getting that work experience beforehand is really important before kind of getting into this career.
Hmm. Anybody else want to chime in?
I'll just add, I never completed my degree. I actually abandoned it in search of something that would land me a job. And I've seen students come in with both. So I have seen students come through the nuclear medicine program that have completed a degree, and those that have come straight from high school. I would say the advantage is maybe more to do with life experience than actually the degree. So, but I mean, I think that's an individual preference. You can enter right from high school. I think nuclear medicine has additional requirements of chemistry, because of all the lab work we do. And there was something calculus, maybe. Yeah. So, um, but I think it's more of a personal preference, depending on the student.
Hmm. And when you talk about personal, and for a lot of people, they may have real, pardon me, different motivations for trying to get into the field that you're in. Like many of you have been able to work with cancer patients. And one of the questions that has come is from somebody who has had that experience, that has been on the other side of radiation therapy and nuclear medicine to try and diagnose and to be a cancer survivor. Just wondering if having that sort of experience being brought into your position, um, I guess, would there be a benefit of having that knowledge? And consequently, is there a risk for them to be able to go into that based on the reality they have had that treatment in the past and now potentially could get further exposure by helping people?
For radiation therapy, we haven't seen anyone like that come into the profession yet. But in terms of talking about the exposure, I don't see there being a risk of exposure for someone who had already previously had that in terms of helping people. It could be an advantage, as well as there could be also a downside of sometimes it's easy to get emotionally attached to each patient since you've been through that yourself. And with this profession, you are seeing at least 20 patients, 20 to 30 patients a day. So you want to make sure that each patient gets the same amount of care and you're not kind of stuck on focusing on something. So it's important to kind of balance yourself out as well. So if an individual thinks that they're able to kind of still maintain that personal and professional boundary, then I would say there shouldn't be an issue with it. But if they believe you're someone that kind of had a rough experience with it, then coming into this profession might be a bit more difficult in terms of managing all the different emotions that not only the patients experience, but you experience as well.
Hmm. Good answer. Thank you for that. Any other thoughts before I go on to the next question? This one, this one actually a little bit more on the fun side, and the aspect of travel. Are there any possibilities, whether it's in Canada to be able to do this work, maybe internationally to be able to take your knowledge and be able to do it in other countries?
I can comment on this one. So I mentioned that it's a national certification exam. So I actually did my training in Ontario and I wrote the exam there. And then I moved to BC. I now work here. And along my career journey, I know I didn't talk about it today, but I also did a locum in Saskatchewan. So that was just an opportunity to do some relief work for one of the sites that their staff needed vacation. And so I actually at the time was working in Ontario and was able to connect with them and go up and and worked there for a little bit. So the answer from my perspective as a radiological technologist is yes, there are some of those types of opportunities out there. There's room for movement and potential for you to move to other countries as well. I know some of the graduates that we have over on the island have gone up to the Yukon, or they've gone to other provinces, or they've gone to the UK, gone through that process to get registered over there. We have someone who's gone over to the United States. I'll leave it to others to see if you have other comments to add to that.
I can add a bit to this as well. After I graduated from the X-ray program, I actually, my adventurous side, started digging into some travel opportunities. And I guess one of my regrets in life is not taking this up, but I did look into there was need for X-ray techs on like Mercy ships, those ships who travel to developing countries to do sort of like pro bono surgeries. I also looked into and actually connected with a hospital in the Bahamas to maybe do a little bit of work there. And that was actually after I was working in the profession for a few years, and I almost went there as well. But yes, though I never did those opportunities, I only looked into them. They do exist, and I think it's a really just a good way to kind of explore what your career could be like in other places. It's a very portable career. And even though it's a national certification, it is a stepping stone to be able to work outside of this country, outside of Canada.
That's also something the association can help support with. We have some collaborations with an organization called Radiological, and we've actually sent some members to go and do some opportunities in other countries as well, developing countries that need more support. So that's also something that's out there.
Here's something else that's come up, and I couldn't help but to notice this myself. And of course, somebody else, mentioned it in a question. Uh, you know, Generally speaking, are there more females than males in this profession? I think this one probably best for you, Sarah, in respect to having a knowledge.
I don't have the exact stat, but I think it's probably somewhere at 75 to 25% ratio. But I'm interested in hearing other perspectives as
I
well.
was I was gonna say I feels more like 50-50 to me. I know that when I was working in nuclear medicine, there were days where I was the only female tech working. And just on Valentine's Day, my X-ray supervisor, Sonia, she took a photo with her team and it was all men. And that was like 15 of them. So I I don't think the reality is being shown with the representation here today.
So gender is not destiny here, right? This
No,
is obviously
I don't
something
think
that is
so.
open for those who identify as male and female.
Yeah,
Open
absolutely.
to everybody, absolutely.
Um, the question always comes up, and of course, we're not asking you to specifically share what you particularly make, but there is the question of salary. People would like to know, generally speaking, hey, if I'm starting off in this business, roughly speaking, what am I making per month, per year, something like that.
Yeah, so all of the hospitals in BC and publicly operated facilities, as well as cancer centers, they're all part of the HSABC union, the Health Sciences Association of BC, so that there's one single collective agreement that actually publicly posts the starting salary and the wage grid for our profession. So it's not really totally secret information. There might be some variability with private clinics, but I actually just looked this up today. I accidentally closed the sheet, but
Hmm.
let me just pull it up for a second here to make sure. So the starting base wage without any kind of shift premiums, because you usually get a little bump up if you do evenings, weekends, callbacks, stats, that sort of thing, is around $36 hourly for rad tech and nuclear medicine. MR starts around 40 and radiation therapy starts around 51 an hour.
Right. Definitely living wages and then some, without a doubt. And I'm curious, does having a degree before that help in respect to that salary level, or is it nope, this is what the pay is for this certification?
So yeah, there is I believe it's our union that puts it in, but it's that a qualification differential, and they correct me if I'm wrong, but about $100 a month extra, maybe something like that, if you have anything, and then if you have your master's, I think there's something more to that as well. I also wanted to touch on there is so much overtime currently, or can be a lot of overtime, so that just doubles the whatever an hour. So
For
thumbs
sure.
up.
For sure. Looks like we have about two more quick questions. Um, just an incidental one from a student at Salmon Arm Secondary. Can people who have a pacemaker or some kind of metal implant in their body get an MRI?
So that's for me. So that's why we would go through the screening process. So what happens is that initially it's gone over verbally with the booking department, pre-booking. Your doctor will also go through it when they prescribe the MRI. And then once you arrive to MRI, the technologist will go through it with you, and you'll also fill it out yourself. So there is hopefully no chance of missing anything. And depending on the implant or what it is, you'll basically go from there, and just to make sure that the patient is safe to have the scan.
Okay, great. Thank you for sharing. This last question that I have, I know I can answer this within our district. They say, is there any opportunity to shadow any of these modalities to get a better idea of what the day-to-day is like? I can say in School District 83, we do have a program that is expanding beyond Salmon Arm Secondary, in that it is a work experience program where students are taken station to station to be able to look at those sort of stations and do sort of a job shadow sort of effect. But that is within our particular district. For the professionals on the panel at this point, what awareness do you have for something like this?
I can speak for a little bit about the island health, the health authority on Vancouver Island anyway. And whereas before we were able to sort of have students or applicants have that opportunity to job shadow a little bit before they entered the program. I think maybe COVID was a major contender and why that was, kind of like that kind of stopped. But certainly now it's a lot about patient confidentiality and privacy that's not something that's possible in Island Health anymore, where technologists where they practice in the hospital. So I think for applicants or those who are interested in the program, it's it's going to be maybe a lot of YouTube searching. It's also great, if you can find a personal connection somehow, and even if you don't know somebody who's in medical imaging, if you know somebody in the hospital who might have an idea of what they do in medical imaging, but they maybe also be able to connect you with somebody in medical imaging to have a conversation. But job shadowing, I would say, is a bit more difficult now.
Yes, and make no bones about it. In our district, that is and has been the biggest challenge, and we had to work that out through Interior Health, but we are confident we have a system that both sides are comfortable with when it comes to that. But thank you for highlighting that.
Also wanted to mention that if you live close to or you're able to travel to one of the campuses, they often do info nights or that sort of thing where the labs might be open for you to go in and have a look, and it kind of replicates a little bit of what the clinical setting would look like because we do actually have real working functional equipment in our educational programs. And I know that there are pockets of health authorities doing some site tours. It could be after hours types of things or career oriented workshop days where it may not be a direct shadow one-on-one with a professional, but it is giving you exposure to some different aspects of the healthcare setting. So, and usually medical imaging and or radiation therapy is involved. I've seen a couple of examples. So just keep your eyes open. Even if you follow the health authority career pages, you might see some of that type of activity advertised.
All right. And with about a minute left, this is where I think we're going to shut her down, so to speak. So I want to send out a reminder for school district. Thank you, of course, all for contributing.